Over 2,500 medical interns are to be dispatched to different health facilities across the country starting August for the cohort 2024-2025. Ahead of the dispatched exercise, the Ministry of Health organized a national induction. The acting permanent secretary at the Ministry of Health, Kenneth Akiiri, notes that over 35 billion shillings have been set aside to facilitate the medical interns across the country.
The President, it is true, directed that we pay 2.5 per intern some time back when the numbers were manageable. But because we operate a budget that has not grown, we discussed and agreed that for purposes of equity, given that the numbers had grown, we accommodate many numbers of interns and reduce the facilitation to 1 million to be able to accommodate quite a number. And that's the decision. From the time when that decision was made up to today, the budget has not grown substantially or significantly to be able to accommodate the area directive given of 2.5. So we continue to pay 1.5, rather 1 million even this time around.
We are going to be training them to do this now on hundreds and hundreds of patients, so that after 1 year, you can now allow them to go and treat the public on their own. So it is more intense than where they have been, and this is the purpose of this meeting. Now,
that allowance is not sufficient. It can't ably run a medical intern for a full 1 month. He's going to rent a house, he's going to pay transport, he's going to pay many bills, he's going to work about 36 hours shift. I feel it is inadequate, and my recommendation and what we shall strive for when we officially get there is to advocate and to ensure that this can be stepped up to an amount which is reasonable.
The acting permanent secretary calls upon the medical interns to understand and appreciate the economy they are operating in and these challenges associated with their line of duty.
The government came in to give facilitation to mitigate, to cover some costs for interns. So we expect the interns to understand the situation that we are dealing with and to take it in good faith, and train, and qualify and come to serve their own countries.
Ministry of Health has assessed and accredited a number of general hospitals to be sure that they have the capacity to accommodate the increasing numbers of medical interns. Officials have urged the medical interns to ensure they address their grievances in a civil way for a betterment of the sector service delivery.
We don't want a situation where it appears like every conflict or every issue you have must be dealt with in a radical manner. So we have advised them that once they detect a challenge at their workspace or where they are training from, those issues can be raised through the leaders who supervise them and handled in a civil manner. So we wouldn't encourage, we call it civil disobedience. How do you call it? Those radical approaches of placards on the street. It is not called for.
Zahara Abigaba, UBC News.